Hello and welcome to the second episode in this series. In this episode, we're looking at the socio-emotional effects of anxiety on older people in care settings as a consequence of the COVID-19 pandemic. The COVID-19 pandemic has had a profound impact on people all over the world, and the elderly in care settings are no exception. The socio-emotional effects of the pandemic on this population have been significant, and it's important to understand these effects so that we can provide appropriate support and care to the elderly during this time. One of the primary socio-emotional effects of the COVID-19 pandemic on the elderly in care settings is increased feelings of fear, sadness, loneliness, and anxiety. Due to the pandemic, many care facilities have had to implement strict visitor policies, which has limited the ability of the elderly to interact with their friends and family. This lack of social interaction and support can lead to feelings of isolation and loneliness, which can be particularly damaging for the elderly who are already at a higher risk for depression and other mental health conditions. Another socio-emotional effect of the pandemic on the elderly in care settings is increased stress and anxiety. The pandemic has brought with it a number of concerns and uncertainties, such as concerns about their own health and the health of loved ones, financial insecurity, and limited access to essential services. These concerns can cause significant stress and anxiety for the elderly, especially in care settings where they may feel more vulnerable and less in control of their surroundings. In addition to these emotional effects, the pandemic has also had a number of physical effects on the elderly in care settings. For example, due to the pandemic, many elderly individuals have experienced disrupted routines and changes in the quality and delivery of care, which can cause confusion and disorientation. This disruption in routine and care can also lead to physical side effects, such as increased falls, increased agitation and restlessness, and decreased mobility. To mitigate the socio-emotional effects of the COVID-19 pandemic on the elderly in care settings, it's important to provide appropriate support and care. One way to do this is through increased communication and connection. This can involve making an effort to stay in touch with the elderly through phone calls, video chats, or other forms of virtual communication, as well as providing access to recreational and social activities within the care facility. Another way to mitigate the effects of the pandemic on the elderly in care settings is to provide support for their physical and emotional needs. This can include providing adequate resources for hygiene and personal care, as well as providing emotional support through counselling or support groups. In addition, it's important to address any specific concerns or anxieties that they may have, such as concerns about their health or the health of loved ones, financial insecurity, or limited access to essential services. Another important way to mitigate the effects of the pandemic on the elderly in care settings is to maintain continuity of care. This can involve working to keep care routines as consistent and familiar as possible and providing adequate resources and support to help the elderly manage changes in their care routine. This can also involve working with families and loved ones to provide additional support and assistance, such as delivering essential items or providing financial assistance. In conclusion, the pandemic has had a significant impact on the socio-emotional well-being of the elderly in care settings. These effects include increased feelings of isolation and loneliness, increased stress and anxiety, and disrupted routines and changes in care quality. To mitigate these effects, it's important to provide appropriate support and care, including increased communication and connection, support for physical and emotional needs, and continuity of care. In the next episode, we talk about various approaches for helping elderly people manage or alleviate anxiety they may be experiencing through a range of creative approaches and activities. Thanks for listening.